Good evening and welcome to the NYC Health and Hospitals Fiscal Year 2025 Annual Public Meeting for the Borough of Manhattan. Before we start the formal program, I would like to call to your attention that we have language translation service available in Cantonese, Spanish, and Mandarin. If you require these services, please call 212-788-3359. My name is Dr. Michael Espiritu, the City Council representative for Manhattan for the NYC Health and Hospitals Board of Directors. I want to thank you for joining us and would like to introduce the other board members who are participating. Frida Wang, Anita Kawatra, Jackie Rowe Adams, Vanessa Rodriguez, City Council Representative for the Bronx, Tricia Tate, City Council Representative Queens, Dr. Mitchell Katz, President and CEO. Also on the panel are Andrea Cohen, Senior Vice President and General Counsel, and a moderator for the evening, and Calicia Hercules, Secretary to the Corporation. I would like to welcome and acknowledge the following individuals for attending today's meeting: Catherine Veloso, Director of Communications, representing New York State Senator Kristen Gonzalez; Alicia Park Rogers, District Director, representing Congressman Jerry Nadler; and the representative from Assembly Member Harvey Epstein's office. On behalf of the board, I would also like to extend our thanks and acknowledge the leadership at our Manhattan facilities: George's Lamont, Julian John, Metropolitan; Dr. Eric Way, Belleview; Floyd Law, Henry J. Carter; Stephen Catullo, Kohler; and Susan Sales, Gouverneur, SNF, and their dedicated staff for providing exemplary service to our public health system and the people we serve. And to all of you here, thank you for your support as we strive to provide access to safe, affordable, quality care to all. Now I will turn the microphone over to the President and CEO, Dr. Mitchell Katz, to continue with his remarks.
Thank you, Michael. Good evening. I'm Dr. Mitchell Katz. I'm the proud President and CEO of New York City Health and Hospitals and a practicing primary care doctor right here at Gouverneur. In fact, I made sure I was wearing my Gouverneur jacket. I know as I walked in, many of you were thinking that you'd like a Gouverneur jacket, but only those people with the privilege of taking care of people at Gouverneur get to wear this jacket. So I'm sorry about that, but I'm very pleased to be here. I want to thank our board members who are here and the staff who organized the meeting, the team that put everything together. I particularly appreciate that so many of you came out to this meeting. Your presence demonstrates how you care about New York City public health system, the quality of healthcare in your neighborhood, and the community both inside and outside of our facilities. My goal is always to expand access to care for more New Yorkers, regardless of their ability to pay or immigration status, advance our mission and values is what we're here for every day. So some achievements I want to highlight. Our nursing team had a phenomenal day, and I'm glad our nurses are well represented here. We hired over 2,000 since March of 2023, and we're now using agency nurses for what they were really meant for, which is people who are out on extended leaves, family leave, pregnancy leave, but not in order to staff us every day. We housed over 375 of our own patients, the Housing for Health Initiative. U.S. News and World Report included all 11 of our hospitals in the best hospitals of 2024-25 list. We continue to be a leader in LGBTQ plus care. All 18 of our facilities earned their Equity Leader designation. Our groundbreaking lifestyle medicine program is now fully expanded, including new sites at Elmhurst, Gotham, Vanderbilt, and Lincoln. We have launched a comprehensive 3-year blueprint to strengthen our behavioral health services. We continue to provide services at our asylum arrival center, which has welcomed more than 170,000 individuals from more than 160 countries. Our health plan continues to grow its membership across the 5 boroughs. Our engineering team is working to reduce our carbon footprint. Our NYC Care, which is our health access program for people who are ineligible or cannot afford insurance now has 125,000 members. We've opened 20 new wellness rooms across our system. Our arts and medicine program continues to beautify our facilities. Our 250 community health workers have worked with over 25,000 patients. And we even launched a podcast called The Remedy. But we're here in Manhattan, and so I wanted to give special attention to the amazing facilities that are in this borough. Belleview received the national accreditation as an academic comprehensive cancer program. It unveiled the new Mohs micrographic surgery for the treatment of cancer. Was named as one of the best hospitals for treating heart failure. The Pride Health Center was named for the 2024 winners of the Interprofessionalism, Humanism, and Healthcare Award. The Adult Primary Care Service, including the geriatric medicine team, was designated as an age-friendly health system committed to care and excellence. Harlem had also a great year. They launched their state-of-the-art surgical retina service. They installed a new computerized CT scanner to obtain quicker and more accurate diagnostic images. And they were just recognized as one of the 2025 best hospitals for Black America. Metropolitan has had a good year as well. The nurses of the hospital's adult ICU and NICU earned a Gold Beacon Award. The hospital earned a Leapfrog A grade. In January, Met performed its 500th robotic surgery. The hospital's emergency department was a recipient of the Emergency Nurses 2024 Lantern Award. The two brand new Ronald McDonald family rooms were opened, and the hospital celebrated a ribbon cutting for a new flood protection center. We have two standout skilled nursing facilities, Carter and Kohler, as well as Gouverneur, where we are now, that are recognized for the amazing care that they provide. Our outpatient service at Gotham received exceptional patient experience scores. The past October, the American Heart Association and the AMA recognized Gouverneur and Sidenham the Gold Plus status for blood pressure control, the Gold Award for diabetes, and the Gold Award for cholesterol control. So a set of amazing borough services within an amazing healthcare system that prides itself on taking care of everybody without exception. But the most important part of today's meeting is hearing from all of you. And so I'm going to turn it over to our general counsel who will outline how the meeting will work today.
Great. Thanks so much, Dr. Katz. I am Andrea Cohen, and I'll be moderating for the rest of the evening. I saw a few people walk in since it was first announced, so let me first just say that we have language translation services available in Cantonese, Spanish, and Mandarin. And I wish I was not saying this in English, and I could say it in Cantonese, Spanish, and Mandarin. And the phone number to call for translation services is 212-788-3359. So we are here. This is the second in a series of 5 meetings that we conduct annually across the city's 5 boroughs. These are the New York City Health and Hospitals Corporation annual meetings, and the purpose of the meeting is to inform the public about the programs and plans of New York City Health and Hospitals, as you just heard about from Dr. Katz, and then more importantly for us to hear from you about through oral and also written testimony that you are welcome to submit about H&H's performance. All of the testimony, everything that we hear tonight, anything that's submitted tonight, will be transcribed and forwarded to all of the members of our board of directors for their consideration. But of course, we have an amazing array of our board members here today to hear it directly as well. I think we have hit the magic hour of 6:30, so registration for testimony has just closed. Let me just tell you a minute about what the rules of the road will be for this evening, and then we can get started. So the first point to make is just that this is an opportunity for the board to hear from you. It's not a Q&A, not a dialogue. Speakers will come to the podium or to the microphone over there and the podium and speak, and we are here, and the board members are here to listen. In order for each of our, looks like roughly 30 speakers to have an opportunity to testify, each speaker is allotted 5 minutes of speaking time. On the table right there, so you can see it pretty well from the podium, is a timer that will provide warnings about the expiration of a speaker's time. It'll be green when you start. At yellow, that means you have 2 minutes remaining in your time. It will turn red when your time is expired. 10 seconds later, it's going to start to flash. And at that point, I'm going to ask you to finish your sentence, not your full remarks, but your sentence. And then you can submit for the rest of the evening. You can submit anything additional that you didn't get to say in writing to Calicia Hercules or any of the H&H staff who are walking around here. And then all of the testimony, both what was said orally and what was written, will be shared with all of the members of our board of directors. I will call each speaker. I will, with your name and the affiliation that you provided to our staff, and call you to the microphone. I will also make a habit of saying who is going to be the next speaker after that speaker, so that you can just get ready to come to the microphone and we can reduce the amount of time in between speakers. So come close if you can when you hear your name. If I mispronounce your names, I apologize. I will do my best, but please correct us when you get to the microphone if I have said it incorrectly. And otherwise, we're so grateful for your being here and your participation, and we look forward to hearing from you. So with that, let me just begin with our first speaker, who is Michael Smook, CAB chairperson for New York City Health and Hospitals Bellevue. Thank you for being so close to the microphone.
Okay, I'm going to start now. My name is Michael Smook. Let me take this opportunity to give a 5-minute presentation at this public session. Today is my second opportunity since Tuesday, April 16th, to speak to this body as the Bellevue Board Chair and to share with you my thoughts, a few thoughts about the Bellevue Board. 3 years ago in April 22, when I joined the Bellevue Board, we emerged out of COVID-19 downturn timeframe. While we began to meet face-to-face, we started to ramp up the recruitment efforts to find new members for our CAB. And to a degree, we have been successful in redoubling our efforts, where we now have 17 members. The second area we have worked on was the legislative committee. Over the past several years, we have doubled the number of participants in the lobby day sessions of 24-25. Thanks to the input of New York City Health and Hospital Community Affairs Office, at this event, all CAB members who attended this activity participated in this virtual and face-to-face conversation. Secondly, through the 2025 legislative breakfast, this committee's work has encouraged a wider range of speakers to give either a keynote speech or featured presentations before or after the main talk. And I have noticed that the audiences are more engaged and energized at the recent breakfast as compared to 2023, as we discuss expanding healthcare, making it more effective, in discussing the channeling of necessary resources relating to the social determinants of a healthy life into the dialogue. We have new CAB members with a variety of experiences and skills, including nonprofit management, IT, pharmacy, nursing, and future medical school students in their gap year. Our new members, some of whom possess a clinical background, are engaged in developing a health fair activity with featured speakers and WellCare demonstration talk sometime later this spring. In addition, prior to the last election, we were successful in registering potential voters in Bellevue's outer lobby to register dozens of people during the first half of October 24. We now seek more community support with the scheduled closing of Mount Sinai Beth Israel campus. We remain mindful of the challenges these changes will create for New York City Health and Hospitals and Bellevue as we continue to strive and meet and exceed our primary mission. The board's patient committee has continued to work on an idea how the Bellevue CAB can better reach out to patients to encourage them how to use online MyChart's utility to schedule outpatient appointments and order refills for pharmaceuticals. In the future, I personally am hopeful that our leaders within the Bellevue CAB's patient committee will partner with Bellevue's chief experience officer, as well as with this institution's chief medical and nursing officers. I am enthusiastic about the implementation of win-win ideas which tie into a program or programs so the community board's volunteers can work more effectively with the full-timers in the offices mentioned above. Now, moving on, my thoughts on how New York City Health and Hospitals, the board's finance committee channels previous citywide healthcare needs assessments. For me, sitting in our video in the October 24 meeting, it was readily apparent that New York City Health and Hospital Board's Finance Committee's efforts continues to channel previous citywide healthcare needs assessments in its day-to-day planning activities. For example, 6 years ago in the 2019 statement, it mentioned the system must act as a cohesive unit rather than the sum of its parts, with sufficient primary and secondary care with access requiring coordination of providers, effective data sharing practices, and connecting across the community. Challenges to be prioritized are to be structural, complex, and require a collective impact approach to hardwire change. A previous CNA report left me with an understanding that NYC H&H leadership and planning personnel addresses the social needs necessary to facilitate a healthy life. In fact, on my Bellevue board CAB application document, I wrote, quoting from that 19 report, and this I wrote in 22, among the greatest needs fall adolescents, young adults, people facing food insecurity, domestic violence survivors, the homeless, immigrants, and a number of other communities in urgent care of remedial health. Having concluded my full-time 30-year career in municipal public health, administration, and finance, which of course is an agency under mayoral supervision, I remain mindful of a quote by one of the founders of modern-day germ theory, Louis Pasteur, who once said, "Chance favors the well-prepared mind." Borrowing from the sage advice, I believe that well-prepared minds, if collaborating effectively together, can produce programs with outstanding results. Indeed, this kind of out-of-the-box thinking is something which I could feel from NYC H&H and Bellevue. These are things we are continually engaged in and implementing. I've concluded my talk. Thank you.
Thank you so much for your comments. And that was with 1 second to spare. And this time, the next speaker is Jewel Jones, the CAB chairperson for New York City Health and Hospitals Metropolitan. And after that will be Joyce Rivers.
Thank you. My name is Jewel Jones. I am the chairperson of Metropolitan Hospitals Community Advisory Board, and I receive my healthcare services at the hospital. I stand here to deliver this testimony as a proud chairperson and a grateful patient. I would like to thank the New York City Health and Hospitals Board of Directors for your continued support of Metropolitan Hospital. We are the hospital of choice for the East Harlem community. I would first like to take a moment to thank our CEO, Julian John, for his work and support. Though he's assumed the role less than a year ago, the changes and advances made are evident and can be felt as you walk through the halls of Metropolitan. The staff is energized because of the continued work and focus on staff engagement. Just last week, for the first time in history, Metropolitan staff celebrated the Hindu holiday Holi, hope I pronounced that correctly. We celebrate culturally significant events, including Three Kings Day, Black History Month, and St. Patrick's Day. While these events seem small, they acknowledge the rich diversity of the Metropolitan Hospital community, and they have lifted staff morale in palpable ways. Metropolitan recently began the Met Heroes program. It is an opportunity to highlight staff who do amazing things both during and after work hours. One of our heroes includes a hospital police officer who detained a man threatening commuters with a lighter on the subway. He subdued the perpetrator until the NYPD arrived. A second Met hero was a hospital police officer who recognized a woman in distress on hospital grounds. The woman was actually in active labor and delivered her baby in our hospital parking lot. The Met Hero Award is more than a pat on the back. It is presented during a monthly meeting for all senior staff to celebrate who we are. Mr. John recognizes that small gestures make a big difference. I believe this engagement and his call for excellence have heightened the dedication of Metropolitan's leadership and staff. Their hard work and diligence have led to local and national recognition, and we couldn't be prouder. And of the remarks that Mitchell Katz gave, Metropolitan had several bullet points. Yeah, just want to add that. We're very proud of being like they had that number of bullet points. Metropolitan success is a hospital-wide effort that has led to national recognition. Metropolitan has been named to the list of best hospitals by the U.S. News and World Report, and we achieved a nationally recognized leapfrog A grade for hospital safety. The nurses of the adult ICU and neonatal ICUs have both earned Gold Beacon Awards, excellence. Our ED nurses earned the Lantern Award for high quality care and the AORN Award for operating room. We celebrate our wins, but recognize we have a lot of work to do. Our community continues to struggle with metabolic diseases such as diabetes, hypertension, obesity, and heart disease. The increased need for mental and behavioral health services is remarkable. Under our CEO's leadership, we are working to meet this moment and beyond. We have expanded the hours of our mental health clinic to increase access for those in mental health crisis, and planning is underway to provide adolescent mental health services. And I must make mention of Metropolitan's emergency room, which is in dire need of improvement. The CAB has been told that $65 million is needed to upgrade the ER, which hasn't been updated in decades. Please note that despite this, our ER still continues to function at optimal levels and provides quality service to all. We as a CAB have been doing our part in terms of getting the word out in and around the East Harlem community and beyond. As a matter of fact, we had an extremely successful and very well attended legislative breakfast on March 6th, where we had several elected officials on hand to hear that the CAB is laser focused on the ER as part of our advocacy efforts, and how we are looking to them for their financial support in this collective endeavor. Finally, in addition to strengthening our ties to the community by working with local community-based organizations to provide education and care, we've gone one step further. We have formed new partnerships with leading local partners like Borinquen Neighborhood Health Center and Bronx United IPA to provide the specialty services needed in our community. And in the process, we are strengthening our own health and hospitals footprint by formalizing ties with Gotham Health to provide mammography and bariatric services. There have been quite a few changes at Metropolitan. We are continuing our journey, and we continue to learn how to be better, not only better healthcare provider, but a better community partner. Thank you very much.
Thank you.
And we have our Chief of Staff, Letitia Theodore Green, with us, and we have Haida, Haida Restituyo, who is the, let me get your title correct, she is the, what is your title? Assistant Director. Thank you.
Thank you so much. Thanks for your comments. Next speaker is Joyce Rivers, the CAB Chairperson, Community Advisory Board Chairperson, of course, for New York City Health and Hospitals, Sidenham. And after that will be Deborah Levine.
Good afternoon. I am Joyce Rivers, Chair of Sidenham Community Advisory Board. Our CAB have a wonderful relationship with Senior Vice President Dr. Ted Long and Gotham Health CEO Michelle Lewis. Both have encouraged open communications, and our discussions are always on how we can improve our centers and community health. And we are thankful for their open door policy. I also want to acknowledge Gotham Health's Manhattan Regional Medical Director, Morris Gagliotti, MD Ashley Umkoro, Manhattan Regional Director, Ambulatory Administration, and Dr. Marie Paris Wilson, Manhattan Regional Director of Nursing. Our Deputy Director, Yesenia Pavone, is the right person at the right time for Sydenham. And we are very thankful for her community advocacy, staff engagement, and vision to make Sydenham better. Ms. Pabon, please stand so everyone can see you. Thank you. Each year, we ask for a larger center for Sydenham healthcare. The staff productivity is not only important to us, but our patients deserve better, and we would like to highlight the immediate needs of our facilities, Sydenham, Dyckman, and St. Nicholas Healthcare Centers. Specifically, roof at Sydenham is leaking, with the estimated cost of $60,000. The HVAC system often fails in the summer. There are issues with providing air conditioning, and in the winter with providing heat to the facility. We will benefit from expanding our radiology offering, but the infrastructure plays a role in the modification of space. We would like to build a new wing at Sydenham, where the courtyard is located for the radiology suite, a women's health center, and a roof garden for staff and event. Have not received the estimate yet, but of course that takes a lot more planning. Exam beds across all 3 sites, approximately 50, with the estimated cost of $80,000. Furniture for all 3 sites, workstations to accommodate small exam rooms with the estimated cost of $50,000. And we have not had a medical director in almost a year. Therefore, no on-site person managing the performances of medical staff and implementing clinical policies and protocols to ensure patient safety and satisfaction. The CAB elected officer will be meeting with Assembly Member Jordan J.G. Wright and New York State Senator Cordell Clare very soon concerning Sydenham's facility needs. I am again giving remarks about St. Nicholas Health Center, the Developmental Evaluation Center, which is a subspecialty Sydenham Pediatrics Department. It provides diagnostic, development, pediatric evaluations, medical treatment, including psychopharmacology, developmental monitoring, care coordination, case management, advocacy, and support for infants, children, adolescents, and young adults with or who are at increased risk for developmental disabilities. Disorders evaluated include autism spectrum disorder, attention deficit, hyperactivity disorder, behavior and developmental problems, complicating pediatric chronic illnesses and disabling conditions. For example, genetic disorder, prematurity, delayed development in speech, language, motor skills, cerebral palsy, and other motor impairments, genetic and metabolic disorders, fetal alcohol spectrum disorders. This specialty is very much needed in our community. The DEC Center is very much needed in our community because we believe the center is not patient-centric, but needs to be painted in the inside to show a more attractive for families that are stressed before they see the provider. We have patients from New Jersey, Staten Island, upstate New York, California, and France. However, we know we need more marketing about the center for our communities. Our centers are located concerning these services. Mental well-being is important to the communities we serve and is an essential foundation for promoting public health and physical well-being. I know my 5 minutes is almost up, and thanks, Dr. Katz, for your leadership, and to my mentor, Jackie Rowe Adams. The Sydenham CAB and community are so proud of you, and you are so treasured. Thanks for your dedication to us, and as Sherry Sadberg stated, leadership is not about making others better as a result of your presence, and making sure that impact lasts in your absence. That is our Jackie Rowe Adams. Thank you for your time.
Thanks for your comments. Next speaker is Deborah Levine, Community Advisory Board First Vice Chair at New York City Health and Hospitals, Harlem. And after that will be Jill Eisner.
Good afternoon, Dr. Katz and all distinguished guests. As you've heard, I am Deborah Levine, LCSW, Director of the Harlem Health Initiative at the City University Graduate School of Public Health and Health Policy. I am also a proud member of the New York City Health and Hospitals Harlem Advisory Board and serve as your first vice chair. It's an honor to stand here before you on behalf of the CAB Chair, Abena Smith, this evening to share some of Harlem's amazing accomplishments over the years. As Dr. Katz has noted, we have been recognized by Black Docs for serving Black Americans as a national leader, and we are truly proud of that. We have also launched a cutting-edge surgical retina service designed to enhance care and provide patients with complex retinal care access and treatment for advanced treatment. In 2023, Harlem Hospital introduced the Da Vinci surgical system as a means of performing surgical procedures with advanced capacity for robotics technology. We're happy to say that this robotics program in the last 2 years not only has completed over 760 surgeries, but we have also brought on a second robot to assist with the work that needs to be done in Harlem. I'm going to truncate this so that I can make sure that I hit all of these key points. I'm also happy to say that Harlem Hospital has received the baby-friendly redesignation. Harlem Hospital has had a proud history of supporting maternal child health through its participation in the Family Baby-Friendly Hospital Initiative. The global initiative has been launched by WHO and UNICEF, recognizing hospitals promoting breastfeeding and optimal infant feeding practices. Harlem Hospital earned this designation first in 2008. I would also like to tell you that our Motherhood Circle, it's a prenatal group. Mothers from across the city come and gather to share their birthing experiences and discuss the importance of prenatal care, offering encouragement and support to expecting mothers. These events give our mothers an opportunity to connect with one another, to learn strategies for ensuring positive breastfeeding, and to have ongoing support. As you also heard, we were listed in the 2024 to 25 hospital ranking as among the top 160 hospitals in the US for heart failure. And in 2024, the US News Best Hospital list. We've also been able, and I will cut to the chase here. One of the things that we're most proud of is our president and CEO, Mr. LeConte, who has also been noted as being recognized by Crane's New York Business List for the 2024 Notable Black Leaders. What I would like to say to you is that even though we are thriving, we have capital needs that are important to being able to service our Harlem community. Not only do we service Community Board 10, but we also receive recipients from 9, 11, and 12. And for us, it means that being able to provide top-notch care also comes with a cost. So we just want you to be mindful that our capital projects also need that level of support. Thank you.
Thanks so much for your comments. Next speaker is Jill Eisner, a Community Advisory Board member for New York City Health and Hospitals, Kohler, and after that will be Marie Charles.
Good evening. Kohler CAB is unique, I believe, as we are the only CAB that has residents on our advisory board, and actually more than half. And that has led to some integral changes at Kohler, specifically in this most recent regime. They have helped us create programming, projects, and things that they need and services we provide. So they've suggested them, and we've been able to create these programs for them. So it's been very exciting. And they have told their stories at our breakfasts with the legislators who've been moved. Instead of hearing from us, they're hearing from people that are actually directly affected. And that gets into what we need because one of the stories was about getting stuck in the elevator because 90% of our residents are in wheelchairs. They cannot walk. And Kohler, as most of you know, is over 65 years old. There's an argument as to when it was built. Two different stones are outside. And so our biggest challenge is to secure funding to maintain or upgrade, most specifically, our elevators, air conditioning, and the fire system, which is as old as the building is. So that's one of our biggest challenges. And number two is staff recruitment. While, sitting in the middle of the East River on Roosevelt Island is fabulous on a spring day when you're walking to the job, it is hard to keep and maintain as the services, subway, the F train disappears a lot, and they're required to take other transportation to get there. And our biggest obstacle right now, and I know the board is aware of this, is that we're losing our leader. Stephen Contullo has been amazing in the short time that we've had him. And what made it so is because he worked at Kohler previously and also at HHC. So he really understood what we needed. And, I was on the board before he got there, and the change has been amazing for us. And we're very sad to see him go. So we hope that you will find someone as, capable and has that type of experience, because we are unique in that we are not a hospital. Even though we're part of hospitals, we're not a hospital. And then finally, flood protection. Hurricane Sandy, bad word. We were impacted, and we're very lucky that there were FEMA funds that were allocated to build protection for the hospital, and that's what stopped. So we're still waiting all these years later. And I just saw what mentioned about Metropolitan getting flood protection, and I know about 96th Street. It's definitely under sea level. So that's what we're waiting to see. So thank you very much for your time. You keep the extra minutes.
Thank you. Thanks for your comments. Next speaker is Marie Charles, the Community Advisory Board member from New York City Health and Hospitals Carter. And after that is Dorothy Durant.
Greetings to Board Chairperson Pagan, PhD Health and Hospital Board members, President Dr. Katz, Health and Hospital leadership, and all community stakeholders present. My name is Marie Charles, Carter CAB member and New York City resident. I have been designated to speak on behalf of LaShawn Henry, Chairperson of the Carter Community Advisory Board, who could not be here tonight. The Carter CAB meets monthly with the executive staff of Henry J. Carter to ensure the needs of our community and patients are met. We serve as the Carter community advocates for legislation, regulations, funding, and expansion of services to meet community needs. Since Carter's opening in 2013, it plays a significant role in the continuum of care of the health and hospitals system. We have two distinct services, a 164-bed skilled nursing facility and a 201-bed long-term acute care hospital. Although we are geographically positioned in the East Harlem community, we admit patients from all 5 New York City boroughs and beyond. Our centers of excellence include ventilator weaning, physical rehabilitation, skilled nursing care, and hemodialysis. When we wave the banner of being one of the best long-term care facilities in the state, it is validated by several external sources, to name a few. Long-term care, acute care is Joint Commission accredited and consistently maintains a 75% ventilator weaning success rate, well above the 50% national weaning success average. Currently, a Center for Medicaid and Medicare Services, 4-star nursing facility, indicating high marks for regulatory surveys, nurse staffing, and quality indicators. Newsweek magazine ranks Carter number 5 out of approximately 620 New York State nursing homes. US News and World Report designates Carter as a high performer for both short-term rehab and long-term care. We believe firmly that the services provided at Carter restore patients to their optimal level of independence so they can return to community to live their best lives. I address you today to ensure Carter's voice is heard and our needs are prioritized. The proposed federal budget tasked the Energy and Commerce Committee with reducing their spending by $880 billion over the next 10 years. Two of their funded programs, Medicaid and Medicare, account for a significant share of their spending. As with other health and hospital facilities, Carter relies heavily on public benefits. Over 75% of Carter's reimbursement is from Medicaid and Medicare. We cannot survive proposed massive cuts to reimbursement. I am making a public appeal on behalf of Carter and post-acute care service line. Please do not forget about post-acute care when budget decisions require priority setting. Carter fulfills the mission of health and hospitals by providing culturally compassionate and quality care for all, regardless of their source of payment, race, sexual orientation, or immigration status. In closing, the Carter Cab is grateful for the assistance and relationship with Myron McLeish, Cab Liaison Jeanette Rosario, Senior Administrator for Patient Experience, and Floyd Long, Carter CEO. We are looking forward to a continued synergy between health and hospital leadership and the Carter Cab that meets the needs of our community. Thank you for hearing our appeal as a representative of the Carter Cab. Thank you.
Thanks so much for your comments. Next speaker is Dorothy Durant, private citizen. And after that is Roxanne Winston. Dorothy Durant, you here? No. Okay. So yes, is that you, Roxanne? Great. Roxanne Winston. Great. As you walk up, I'll say you are a certified nurse midwife working at New York City Health and Hospitals. It doesn't say which. And after that will be Judy Weston. Go ahead.
Oh, thank you so much. I was really hoping to have that person before me to prep myself, but my name is Roxanne Winston. I'm a midwife at Jacoby Hospital in the Bronx. And I'm also a member of NISNA. I come here to speak about the issues facing many of us in the hospital that I think we speak all the time about how much we care about maternal mortality and the crises affecting the members of New York City. But we forget that some of the staff, most of the staff that work in these hospitals are also members of New York City. And so we're asked to care for folks and to provide to the sick, but then when we ourselves are sick, there's no compassion or space for that. And I don't see how we're really supposed to be able to care for others when we're not being cared for or respected for in our workspaces as well. So although I am employed technically by PAGNI, I work within the H&H system and I care for New Yorkers that receive care within our system. I'm not directly affected by the changes in the sick leave that are affected many of my nurse colleagues because I'm under a different contract and with a technically different employer, but I directly feel the effects of understaffing that affects my nursing cohorts and also our midwifery cohort. And I can see how punitive sick leave policies are actually not addressing the underlying core issues that are structurally impacting us. As of right now, in the next couple of weeks, our midwifery team is going to be down by 5 midwives. And this is a mix of different things. We're a cohort of 30 people. So to put that into context, that's like 1/6 of our population. And that's a mix of people taking sick leave, or maternity leave, people who have retired, folks who have left the position because they found more competitive pay in other locations. And what that means for us is that in the next month, we anticipate that we're going to have 31 uncovered labor and delivery shifts, which is out of this world. I don't understand, and I don't think anyone can envision a safe, well-staffed unit when we're looking at 31 uncovered shifts. And it's not just felt on the midwifery level, it's also, we see it with amongst the nurses. I just worked a shift last Saturday where we had 4 nurses overnight to care for the entire labor and delivery floor. And in that time, we also had an OB stat, we had a hemorrhage, we had like 3 different deliveries, people just coming in active. We simply did not have the staff. We make it work, we always make it work, but it comes at our expense. We have been fighting for a fair contract. The midwives at NCB and Jacoby have been fighting for a fair contract for over 18 months. And in that contract, we've made stipulations and recommendations for better staffing so that we can create a safer unit for our patients. And when we don't have that, that doesn't just mean that, you know, people get less time with their providers. It means that if I call out sick, I know that my patients may not be seen that week, that they just have to be pushed on to another week. It means that we don't have staff to be in our options clinic for folks who might have acute care needs, like maybe they have a pregnancy of unknown location that needs to be cared for immediately, and I have to push that care off. That means that we can't see our patients in mother-baby clinic. That means that we can't see our patients on the labor floor, on postpartum, in our Team 6, our care for patients who are pregnant and have mental health conditions. It means across the board that our patients are suffering. I can confidently say that our patients deserve better and that we as New Yorkers and staff of New York City Health and Hospitals also deserve better. So I ask that we not waste our time thinking about punitive policies around sick leave and instead, like I mentioned, address structural issues such as making sure we have sufficient coverage for the earned time that staff are allowed or allocated, and ensure that ultimately we keep our units safe for all, and that means good staffing and good sick leave policies.
Thanks so much for your comments. Thank you. Next speaker is Judy Wessler. Judy Wessler, retired former co-founder and director of the Commission on the Public Health System. Hi, Judy. Yes, no, you don't. I'll take my time. And after that is Kent Mark.
And I'm here as a board member of CPHS. That's the faster way
Great. Thanks.
saying, and hi, Jackie, and hi, Mitch. Hope you're all well. I hope you see my sign. I want to know where the hell you are on these issues because you ain't been seen. And that includes, unfortunately, I think the cabs. Great lobbying on the state level, but we have a little problem federally, and you know, y'all are needed out there doing that. And I'm sure Neisner can talk more about that. What I want to talk about tonight, everybody's been sort of positive. This is not necessarily so. CPHS has been involved in, we actually were formed around saving some hospitals at HHC, which we used to call you guys. And, you know, kept up that. We're involved with the Council of Community Advisory Boards for years. We're on the agenda, gave reports, shared information. A year and a half ago, I was told we would know, these were not the words, so, you know, don't throw them back at me, but essentially told we weren't welcome at the Council of Cabs anymore. And allegedly, because I was no longer on the Gouverneur cab, allegedly. I think that's pathetic. we were sharing information that was not necessarily being shared by staff of H&H. And I think that's really unfortunate. I was a member of the Gouverneur Cab, and I'm a patient here and at Belleview, and places are overwhelmed. I'm waiting 6 months for an appointment with the cardiologist that I had been seeing. That's very sad. There are things that need to happen. There's work that needs to be done. H&H used to be actively involved in the quote worldly issues like federal cuts, and now is a crisis time. And I don't know about anybody else, but I'm sure I haven't seen anybody or know where you are on it. So I come here with a request, I guess, in some ways, to open up again, to be a part of what needs to happen. I know the mayor is a little conflicted on this issue, but you are not, I have to remind you, you're not a mayoral agency. And if I have to say that again, you are not a mayoral agency. And therefore, H&H, but I'll still say HHC, should be involved in these fights. Mitch, you remember the state stuff about indigent care pool and the great role that H&H played? Doesn't seem to be happening. I don't know where your governmental, whatever title the staff has, what they're doing, but going it alone doesn't seem to be the way to go now. And hopefully, that message is received. Again, I feel really sad, disappointed, and I guess angry that CPHS got locked out of activities and out of the Council of Community Advisory Boards. But I don't think it's just CPHS that this happened with. And again, going it alone in the atmosphere that we're living in is not going to work. So please think about it and hopefully open up. I was gonna warn you that I was gonna say this, Mitch, but I decided not to. That you might try to talk me out of it, and I'm not going to be talked out of it. So, thank you. Come on. So I say welcome to the new Manhattan board member. Didn't know that Barbara wasn't still on the board, but it's good to have somebody. Oh, hey, don't be nice to me. I might come back.
Oh,
Thanks. So
Judy, you're near the end of you're at the end of.
I know, and you're not going to stop me. You spent 20 minutes having dinner while I was sitting here waiting. So
We're just trying to
give
give everybody
okay,
a chance.
but I'm going to let them speak. And I just want to sort of tie what I said together and hope that it wasn't being too hostile. It was meant in a way of really caring about this system, both for me and the very many patients who use and need the system, and it's going to get worse if these Medicaid cuts come in, because NYU doesn't take care of people now, and they're surely not going to take care of them without coverage. So, and that goes for most of the rest of the systems. So think about, please, again, not trying to be isolated and going it again alone. Be happy to sit down with you and talk to you about with others. We are talking to Dr. Long about the issue of cutting patient care time, which was a bad move. And All right, I'll stop. So I get it, you know, there are other people that want to speak, but I think you all started late, so it ain't my fault. Thank you.
Next speaker is Kent Mark, private citizen, and after that is Mark De Sola Price. Go ahead.
Just to correct the record, I didn't register as a private citizen, as a Belleview patient with referrals to other entities within the system, such as Metropolitan,
Thank you.
Elmhurst, et cetera. So, good evening. The name is Kent Mark, that's K-E-N-T, Mark, M-A-R-K. And as you said, I'm a Bellevue patient. I'm a former cab member for 3.5 years on the Bellevue cab. And I would echo some of Judy's comments. I'm going to make some comments here tonight that are not complimentary by any stretch of the imagination. I think there's plenty of people in the room, though, that have something positive to say. And I think it's important that people who claim to be in a leadership role hear what's wrong with an organization. But I was told, Ms. Cohen, by your colleague, Blanche Greenfield, last year, that I should keep in mind when I spoke at Kings County, and I did just that I should say something nice in the beginning, okay? And perhaps something nice at the end with my criticisms in between. So I want to thank you for all the services rendered. I really appreciate, and even though some of my comments may seem to be denigrating, they're not meant to be that way. They're meant to help improve the system and to reach a new high in this system for other patients who may not have the background I have, the experience I have. This is not, I'm not bragging. I'm just saying I see a lot of patients that inhabit this system that are not qualified to speak up, that are scared of this system and don't know how to make changes in this system. So I thank you for all the lives you save. I thank you for all the good people in the system. There are a lot of good people that I talk to at Bellevue and other facilities that are really there for the right reasons. There's naturally some bad apples. There's bad apples in every system. So I thank you for the good people in the system, and they often labor under very difficult conditions, and we appreciate that. But all of that begs the question as to why this system couldn't be better and why it has to continue to live in this culture of the past where people just insist on doing things the way they did them 40 years ago or 30 years ago or 20 years ago. I think it's ridiculous. The narrative is all wrong as far as I'm concerned. There's a lot of talk. I've been to PFAC meetings, I've been to CAB meetings, and they say there's nothing more important than the patient. Meetings are secondary. Phone calls are secondary. Reports are secondary. And then what do you constantly hear as a patient, whether it be at Bellevue or other places? Well, you know, I got a report to write. Well, is that more important than me as a patient? Why are you here? But that's not to criticize everybody, because somebody told me at Bellevue today, you know, I recognize why I'm here. I'm here to serve you. So there are good people out there that know why they're there. I think it's too compartmentalized, and I think it allows for a lot of pass the buck and a lot of excuses. So as far as I'm concerned, what I'm going to say here, I have no power to decide how you receive this information, perceive it, or process it, but I think it needs to be said. And I think rather than talking to each other and slapping each other on the back, which I see a lot of at Bellevue, I think that you ought to, somebody in leadership ought to talk to patients such as myself and find out what's really wrong with the facility and how we're treated, especially patients that can tell you actually based upon law and fact what is wrong with this system. So today at Bellevue, for example, I went for a blood pressure check based upon what my cardiologist asked me to do when I come to the hospital for other services. Took 2.5 hours, a minimum of 7 people were involved. And I was told yesterday you shouldn't have any problem. You'll just walk into general medicine. We're not going to be sending people to the emergency room and wasting those resources anymore. We're going to take care of this in general medicine. Well, that took 2.5 hours, and I knew more about this process than the people in general medicine. Didn't even know what they were supposed to do, in large part. 7 people in 2.5 hours. If that is not a waste of resources and aggravating a patient. And then they wondered why my blood pressure was high. The ER. I spoke to Ms. Cohen last year about this. I spoke to Blanche Greenfield about this. As far as I'm concerned, the process set up at the ER is a search and seizure. There's no probable cause, there's no reasonable suspicion, and there's no warrant. I've been told any number of times by Mr. Egan, when he was there, and other people, that this is supposed to be looked into and this is supposed to be conducted in a proper manner. Yet today, I was told yesterday by patient advocacy that under EMTALA, they don't want their funds taken away. No one is going to tell Mr. Mark or anybody else If you don't submit to a search, you're not coming in this emergency room. You can go to another hospital. That's not going to work with me. I'm not going to tolerate that kind of stuff. So I tried to walk in there today, and they stopped me and came after me when I walked through. And they said, well, we don't know anything about this. Now, how can this be that we have systems put in place that violate people's rights, that are lawsuits waiting to happen? And I'm interested in educating people, not suing them. But there comes a point, if people won't listen and won't respect other people, then something else has to be done about it. So I see those kinds of things as a problem. I'm dealing with the dental department in MHC, where I was referred to, and I'm sure that some of the people here recognize me since I've talked to them. And we've got all kinds of issues up there. They said they're going to resolve this by having me come to a PFAC meeting. So I guess I'll do that and I'll talk there. There are just so many things here.
Will you conclude your remarks, please?
Okay, could you just give me a moment to close them out? Thank you.
Please
I appreciate that. Okay. So, I've been assaulted by a hospital police officer, virtually nothing done except a speech from Catherine Gursky. I just don't appreciate this treatment. And I spent time on a cab to make this a better organization because I really am thankful for what they do for me and what they do for other people. But why we get treated like this and why we can't be treated better, I don't know. We need accountability and we need penalties for those people that misbehave. Thank you for your time. I appreciate it.
Thanks. And if I can just ask the audience, since we do have a large number of speakers still to go, if you could please conclude when the light turns red, I would appreciate it very much. And I think everyone in the room would. Mark DeSola Price, also private citizen, author and activist. Mark DeSola Price. Okay, and if not, Ray Briggs, president of the NISNA South Brooklyn Health LBU, and after that, Sarah Dowd.
Dr. Katz.
Nice to see you.
That's my man there.
Nice to see you.
Dr. Katz, my name is Ray Briggs from South Brooklyn Health LB president. Dr. Katz, you're my motivator and follow you. I listen to you very keenly. I like your vision and keeping it. Welcome all of you to Governor. Welcome my fellow colleagues. Welcome the people from the community. All of us at home. This is our home. H&H is our home. And we'll do our best to protect and defend H&H by all means necessary. Dr. Katz, I follow you from day one when I saw you at the City Hall. I saw you came in, this graphic guy said, he's our CEO. I said, yeah, Dr. Katz. I said, oh, I like his movement, like his beard, like his stuff, simplicity. I like that, Dr. Katz. Really, truly, I like that. My mission here today is to let you know that if you can rescind and reverse the sick leave policy that has been forced upon the nurses of H&H, nice to nurses, H&H. The important thing is that I will just give you two stories. Right now, what we're finding is because there's a lot of closure in the private sector hospitals, our hospital that people used to bypass and go to Northwell, go to Mount Sinai, all those highfalutin hospitals, they are now coming to South Brooklyn Health. We have a large percentage of Caucasian white Americans coming to South Brooklyn Health, which was never used to be the case. We used to have people from homeless people shelters, from the streets. Now we're having a whole influx of those people. Our ED is overrun. I don't know if you know it, but we have a very high percentage of patients in the ED waiting for beds. They have no beds. Even though, with 15 minutes up maximum time, we send one patient, discharge one patient, get another patient coming in. We don't have enough beds at South Brooklyn Health to care for the community. That's how bad it is, as well as the fact that we don't have enough nurses, which even make it twice as bad. So this sick leave policy that you put in place is a demotivator. It turned the nurses them away. The nurses them are leaving. And they have nothing to hold on to. And this sick leave policy where we have 3 days as one strike, it helped a lot. You might not notice, but it helped a lot because money is not everything. Infrastructure is not everything. As you rightly said one time, you said, if I have a room and I put 2 nurses inside there with equipment, I could make that an ICU room. You said that, Dr. Katz, and that's what I like about you. Very practical, very combat-oriented. Thank you. Yeah, so as one nurse named Holly, she was sick on the unit. And the clerk came over and told me, being the president, she said, Holly is sick. Holly cannot even see. She's dizzy. She has to sit down. She can't see. The nursing supervisor came up, and she was actually telling Holly to give medication in her sick way, in her sick form. She was telling Holly to give the medication, give this, give that, Holly. No, yeah, everything gonna be okay. You're gonna be fine. You're gonna be fine. When I raised hell, then they decided to send Holly to the emergency room. She suffered from vertigo, so she did not take her medication in time, so she was feeling dizzy, right? The next thing again, what we find is that the nurses in the ED, because the fact that they're short, as well as the unit, they're being penalized. It's being used as a punitive measure to galvanize the nurses into increasing production and productivity. And that is a no-no, because we're getting a lot of feedback in terms of nurses are saying, if we are going to work hard, we're going to work this hard. A lot of things that the nurses overlook management. There's a lot of things more than management come back with at the nurses. There's a lot of things, I said, nurses, we got to let go sometimes. You got to be working for the community. We're not only working just for the sake of salary. Like in terms of when we had a negotiation, Mr. Adams was nowhere to be found. He didn't speak on our behalf. You spoke on our behalf. He didn't do that. You did that. For the 5-year COVID pandemic, you gave him some credence, and now he's running for mayor again. You gave him that. Come on, how much more are you going to take from the nurses? All the nurses that died during the COVID, did he mention that? Come on, Dr. Katz, you know different than that. You know me and I know you. And one last thing too, when we had a negotiation, the PFL, we offered that, listen, let the city pay for our PFL. Because these young ladies and beautiful women back here, maybe one day they will have kids. Who don't have kids may have 4, 5, 6, I don't know. But what I do know is that we pay for our PFL. We pay for our PFL. We offer the city, would you pay for our PFL? No, we can't do that. As a goodwill gesture, no, they can't do that. Now we pay for our PFL, right? Because we think it's beneficial to these mothers and husbands out there to take care of the young ones.
Mr. Briggs,
Thank you.
conclude.
Thank you very much, Dr. Katz. You're wrong, Dr. Katz.
Thanks for your comments. Next speaker is Sarah Dowd, private citizen. Sarah Dowd. And after that is Dr. Nicola Nasser.
I don't know how I could follow the great Ray Briggs. My name is Sarah Dowd. I work in the ICU at Kings County. I've worked at H&H for 8 years. We have a lot of nurses here from Kings. I worked at H&H throughout the pandemic. Even as my coworkers left to take contracts, they traveled, they made a lot of money. I stayed. And I stayed because I believe in what we do here. To work here means something. This is a system where nurses can really make a difference. We care for people who are completely shut out and forgotten. They have no access to the wealth of our incredible city. We care for people that, because of the system, were never meant to be healthy or have good outcomes. We care for New York City while carrying the entire weight of the dysfunctional American healthcare system on our backs. We are disturbed that H&H is trying to take even a single thing away from this city's caretakers, while our patients are the ones who will bear the brunt of these impending budget cuts. You're telling nurses you expect them to work sick. You're telling our patients to face additional exposure to communicable diseases while we're trying to care for them. You're telling patients that they can't be confident that they're receiving care from someone who's well enough to care for them. That's what you're saying. This policy change is not good for our patients. It's not good for our communities. It's not good for the nurses that live and work in the communities that H&H serves. And it's surely not good for your budget when you find yourselves right back into the throes of your post-COVID nursing retention crisis, because you made it easier for middle management to harass us for taking care of ourselves and our families. We have the right to be sick, put it back to how it was, and put it in writing.
Thanks for your comments. Next speaker is Dr. Nicola Nasser. Nicola Nasser. Okay. And if not, next speaker is Elysia McMyers, also from NISA. And after Elysia, Judith Hutchin.
Good evening, good night, everyone. I'm Elysia McMyers, Dr. Katz, Ms. Cohen, Mother Jackie. Good evening, CAB. I'm a registered nurse. I've been so for many, many years. I currently work at Harlem Hospital. I'm an accountable care manager. I'm just going to go back perspective-wise to what I call legacy RNs, and those of us who have been here for 20 plus years. I originally came in, thank you, 25 plus years. I originally came in 93, left in 96 with the layoffs, came back in 2002 because I knew that Harlem was my home. I've been a staff nurse, I've been a nursing supervisor, and currently accountable care manager. And what we're asking is for this reinterpretation to cease and desist from since I was a staff nurse in 93. It has always been 3 or more consecutive days would equal 1 occurrence. And that's not just for a staff nurse. Ask your hospital police, ask a clerk, ask environmental services. Anybody could tell you. It was always meant that way, right? So I also say, I've grown up in the system. I've also grown up as a membership chair. I welcome new staff members. I continue to do so as the LBU vice president, not only system-wide, but at Harlem Hospital. And I talk to them about the great experiences here at Health and Hospitals that you won't find anywhere else, that you can truly grow, truly get your experience and make a difference, because we know the community that we serve. We just walked on Sunday from Foley Square way down to Bowling Green with all of the other unions to stop the cuts because we know that they're coming. We want to work together with you. So work with us. Let this interpretation go back to 3 or more occurrences equaling 1. And I'm just going to point out that it was so amazing that today we had a system-wide webinar on wellness in the workforce place, right? So I'm just going to quote what we talked about. We talked about workforce wellness, culture, and how to foster an environment that prioritizes both employee, let's say that again, employee well-being and patient care. It also included a great discussion on a culture of safety. We all come to work to give our best to the patients we serve. But when we get sick, we have to make sure that they have a safe environment. So we call out. We don't want to get them sick. So staff need to be supported, and this reinterpretation makes staff feel undervalued.
Thank you for your comments. Next speaker is Judith Hutchin, head nurse in NISA from New York City Health and Hospitals Woodhull, and after Judith, Adam Marcus.
Hello. Hi, everybody. Dr. Cass, everybody, the panel. Hi, Jackie. Hi, my name is Dr. Judith Hutchin. I am the first vice president of NISNA. I've been a nurse at Woodhull Hospital for 33.5 years. I am also a proud patient of New York City Health and Hospital. I was born in Kings County 60 years ago. I stand before you to bring my concerns regarding the sick leave policy, like all of my colleagues and people that were there when I was born, right? It's been unfairly implemented, changed without discussion or any effort to find out why nurses are calling out in the first place. With the increase of respiratory and other serious illnesses that plague our city and nation, we need policies that are consistent, unbiased, fair, and meets the needs of our workforce. In addition, fair sick leave policies are essential at every H&H healthcare facility because they protect our patients and staff from the spread of infection and focus on the well-being and safety for patients, their families, and the staff. Please listen to the nurses. Nurses are feeling tired. We're sad, we're burnt out, feeling helpless to the point that they're coming to work sick to avoid being disciplined or risk losing pay. For example, a nurse who works with a vulnerable, very vulnerable population was sent home by OHS to prevent cross-contamination and was instructed by the H&H PCP that she goes to, because she's also an H&H patient, not to return to work until the infection is cleared. Upon return and with the required clearance documentation from the provider, the nurse received a notice of counseling. Now, how is this right if the facility's own policies state you cannot work with an infectious disease? Do we not acknowledge our own policies and procedures? And how about the nurse who received a notice of counseling after returning from a life-threatening illness and was on an approved FMLA and received that notice of counseling? The reps, myself as the LBU president, we are being inundated with counseling requests, 10 and 15 at a time from one manager. And it's no exaggeration, I could show you. How do we recruit and retain nurses if we are basically be telling them, you can work in H&H, but don't get sick? This does not reflect the well thought out IKEA vows practice at health and hospitals, nor does it reflect regulatory requirements from agencies such as the DOH and the Joint Commission. And speaking about regulatory requirements, I'll share a statement that I read recently in the Joint Commission Journal on Quality and Patient Safety that reads, and I quote, "Sick leave policies are essential in healthcare as they provide patient safety and ethical practices by allowing healthcare workers to take time off when ill, thereby reducing the risk of spreading infections and burnout and ensuring they focus on well-being. And the Joint Commission and no other regulatory agency should be dictating that to us. We should know that nurses, any staff cannot work sick. Our patients are at risk. And I am hoping that we can come to a resolution that puts the sick call policies and processes back in place so that the dedicated nurses of the New York City Health and Hospitals, where I was born, I'd like to mention that part, can continue to provide the highest quality of care to our patients, their families, and the community, all while having the ability to remain healthy and not fear repercussions for being sick and the risk, health, and safety of our patients, their families, and the community. Thank you for your time.
Thanks for your comments. Next speaker is Adam Marcus, also a staff nurse. Adam Marcus. And after that is John McShane.
Thank you very much. My name's Adam Marcus. I'm a pediatric and adolescent psych nurse at Kings County Hospital, and I'm a lifelong New Yorker. A lot of times when talking about providing any kind of public good, any kind of human dignity, the question is, well, what's that going to cost? Especially when talking about people who have been historically and currently disenfranchised. But that belies the question, well, what's the cost of not just business as usual, but an increase in cuts to this? And that cost is twofold, right? There's the cost to the increase in attrition rate as nurses vote with their feet and go to work in better working conditions. And there's another cost, and that cost is a body count. And I was hired in part to replace nurses who are left for various reasons. One of them I never met. Her name is Raya Henry. On Sunday, she was at work and she called the nursing office, both because she wasn't feeling well and because the staffing was horrendous conditions, which is a common occurrence across disciplines in the public sector. And she was told in no uncertain terms to be quiet and to do your job. That was on Sunday. On Tuesday, she was dead. Yeah. So who's next? My head nurse has been working sick. I'm also a delegate through NISNA, and nurses talk to me every week about how they're too afraid to call out. People have been having anxiety and panic attacks in work, before work. And in terms of best practices, there's a bevy of research out there, including well-known authors, both from an infection control perspective and even in terms of the effect of stress, right? Including Robert Sapolsky, Gabor Mate, and others. But let's be honest, this is not about best practices, right? This is about power, right? We already know what best practices are because we wouldn't tell our own patients, oh, you're sick, you should go back to work. Whether that's because you have an infectious disease, you're having a panic attack, you're having another mental health crisis, right? Nurses have killed themselves. It affects us too. It's about power. It's about, okay, can we get away with taking away the basic human right to be sick? Because the truth is, you don't think that our patients deserve the same as patients who have more money, who have more access to power, right? Does this happen when senators are sick, right? Right? What are their ratios? 1 to 1, something like that, right? This just happens with our patient population because you don't think that they deserve the same basic human rights that those with more money and wealth do. And so you wanted to say, well, will you take this laying down? And I think you got your answer today. So you let me know what you want the next move to be, because tonight's the beginning. Thank you very much.
Thanks for your comments. Next speaker is John McShane, a physician, John McShane. And after that, Wendy Zhao.
Hello, my name is John. I'm a nurse at Kings County in the emergency department and a NISNA member. I'm really proud to be a nurse at Kings County. I live 10 minutes away in Crown Heights, and I like serving my neighbors and people that I live with in my community. I'm really proud to also be a nurse for H&H. I think it's really special that our city has a robust public healthcare system that cares for all of its citizens. Not many other cities in this country commit to doing that. I love my job, but it's really not easy. Every single day, I'm in awe of my coworkers who work their butts off to heal the sick in this city. Under, frankly, lethal staffing ratios, day in and day out. There are days when I've had more than 12 patients. Sometimes nurses have to assign more than 20 patients to their names if there's no lunch coverage. And as many speakers have said before me, many of our patients are some of the most vulnerable people in our community. And day in and day out, I'm really amazed to see the healthcare workers at King's work to make sure that these people and all of our patients are cared for properly. We have a lot of pride in the work that we do. And it's really clear how much everyone at King's cares about caring for others. So why does it feel like H&H leadership doesn't care about us? We work a really tough job under really brutal conditions. And we do so to serve a public good. It's a real shame that what we get in return for that service is the prospect of being disciplined for being sick. And sickness is a hazard of our job. We take on risk We take on risk to our health so that we may care for our neighbors. When I was hired, I learned that we accrue a certain number of sick hours every month. I was surprised months later, because it wasn't mentioned in my orientation, that we were also subject to something called Operating Policy 20-10, which states that we can only call out sick 3 occurrences in a 6-month period. It was explained to me that an occurrence could include multiple consecutive sick days, like when anyone in this room has been sick with the flu for more than a week. 2 months ago, I learned that this policy, which has been in place since 1987, was being reinterpreted, that consecutive sick days would no longer count as one occurrence, and that each individual sick day would be counted as an occurrence, meaning that you can only be sick for a maximum of 3 days in a 6-month period before you're counseled by your manager. Reinterpreting Operating Policy 20-10 in this way is unconscionable, I think. Being allowed to be sick once for 3 days in a 6-month period is unconscionable. Frankly, I believe the entire premise of the original policy is unjust. I think we accrue 8 hours of sick days or something like that every month. And I think that healthcare workers should be able to use the hours that they accrue as needed without restriction. And so I think letting healthcare workers use the sick days that they earn is the least that H&H leadership can do to make sure that we're supported in our roles as healers and to protect the patient population that we serve. Thank you.
Thanks for your comments. Next speaker is Wendy Zhao, also from NISNA. Wendy Zhao, and after that is Sean Petty.
Good evening, everyone. I'm Wendy Zhao, a proud staff nurse of South Brooklyn Health. I have been there for over 5 years. I chose to come to New York City Health and Hospitals. This is my first and only nursing job because of our shared values, our incredible mission statement that we care for everyone, regardless of their background or ability to pay. I have had the immense privilege and pleasure of representing our amazing accomplishments to other healthcare systems at local and national conferences. I have heard so much praise from other systems motivating them, such as Johns Hopkins, Mayo Clinic, NYU, Kaiser Permanente. They are seeking to replicate us because of our incredible work. It was even at the Institute for Healthcare Improvement's annual conference on advancing clinical care on a global level at the 2023 IHI Forum. I had the pleasure of once again representing us and presenting our work. It was even there that our Dr. Eric Way and other representatives from Quality and Central gave this amazing presentation on our culture of safety, on how we had our sense of safety broken and restored during the pandemic, and how much we had to rebuild. And I was so amazed when I was there at all these other healthcare systems from all these countries, how they look to us. We are on the forefront of addressing social determinants of health, applying an equity lens, a wellness lens to our staff. That deep respect they hold for us. And today, I stand here so tired and even ashamed because now I have to present my colleagues' shared distress over this reinterpretation of a sick leave policy, that during this terrible URI season, my colleagues are bringing themselves in when they're ill, risking themselves becoming sicker, risking their patients, risking our other coworkers because they feel intimidated. They are scared to lose their livelihoods. Sometimes they're the only income bringer for huge households. So please restore our psychological safety. Thank you.
Thanks for your comment. Next speaker is Sean Petty, president of NISNA at Jacoby, and after that is Crystal John.
Oh, it's okay, Sean, you can hold it.
Okay, I felt better. So my name is Sean Petty. I'm a pediatric emergency room nurse at Jacoby Medical Center. We're the only pediatric trauma center in the Bronx and Southern Westchester. I've been there for 17 years, and I hope to be there for 17 more years. That depends on how much I'm forced to come to work sick. I'm not gonna lie. I've seen too many coworkers suffer through COVID. We had one coworker die during COVID. We had two coworkers come within hours of losing their lives in our own ICUs. We lost hundreds of nurses across the city. We were the epicenter of the epicenter. And still nurses by the hundreds and thousands showed up to work every single day in our system. And now we're on the precipice of the most significant cuts, federal cuts to our budget since Medicaid was founded in 1965. $880 billion, 10% of the entirety of Medicaid services is what is being proposed in the congressional budget. This would be catastrophic cuts to our system. We need all hands on deck to fight this menace. When our political leaders have threatened the integrity of our hospital system, NISNA nurses have been the most significant force in fighting back and changing those policies that those political leaders have tried to do in the past. When Mayor Bloomberg privatized dialysis in the city system, NISNA nurses were the ones that fought back and got it unprivatized. When the combination of COVID and the widening disparity between the public and private sector when it came to nurses' working conditions and pay was so large that we lost over 4,000 nurses in our system over the course of 5 or 6 years. It was us who took time out of our lives to fight back, to force our mayor to give us a contract that now allowed us to rehire those 4,000 nurses over the last year. When our political leaders failed to provide us PPE during COVID, it was NISNA nurses and H&H that fought back and forced the governor to change the policy, forced the administration to change the policy to give us the N95s we needed when we needed it, and that saved nurses' lives. And it was us who led that fight there. And we will lead this fight again. We will lead the fight to stop these Medicaid cuts. We will lead the fight to stop whatever this administration throws at us, mass deportations, the threats to our democracy. We will lead that fight, but we need to be at full strength to lead that fight. I cannot for the life of me understand in this climate why this administration in H&H would choose to make this a priority, to go after nurses. We could be talking about reversing the horrific disparities for maternal and baby health among African Americans in this city. Like my sister, who's a midwife at Jacoby, We could be talking about fighting for, how do we safely staff our L&D unit both in midwives and nurses at Jacoby. We could be talking about how do we stop and how do we understand why asthma deaths in this city in my emergency room have doubled and tripled in the last year that nobody is actually discussing and analyzing. We could be talking about that. But instead, we have to be here just to fight for what is a right that we've had for 40 years. And you're choosing now, the time when the wolves are at our door, to go after us. It makes no sense. So again, we need to be at full strength. Dr. Katz, Ms. Cohen, we have to change this policy. It has to end. We're going to be on the front lines. We need you to be in the streets with us. We need to stop the threats, the existential threats to our system, because all of our survival depends on it.
Thanks for your comments. Next speaker is Crystal John. Crystal John from Kings County, also nice member from Kings County. And after that, Joseph Goal. I think it's Goal. Go ahead.
Hi, good night. I am so nervous. This is my first time here.
Don't
Hi.
worry.
I want to start by saying good evening to everyone here. I'm Crystal John. March 3rd this year marked my 10-year service at Kings County Hospital. And like everyone here in the room, I echo the sentiments of all the nurses here and within HHC. Every winter since the start of the pandemic, we have seen an overwhelming surge of patients with the flu, COVID, RSV, and more. 5 years later, hospitals are still struggling under the weight of these seasonal waves, and frontline nurses are bearing the brunt of it. As a former ICU nurse who worked through the peak of the pandemic, I have seen firsthand what it means to push through exhaustion, to show up even when every instinct tells you to quit. I have seen my colleagues do so also, because we care about our patients and we care about each other. But what happens when nurses get sick? Nurses will be now forced to choose between their health and their paycheck, pressured to return to work too soon. One day is not enough to recover from any illness, yet we are made to feel that taking time to heal is a burden on the system. H&H new interpretation of the sick leave policy will hurt nurses and patients. This interpretation to our sick policy leave is punitive and unfair. Nurses will now be counseled simply for using the time they've earned. We will be pressured to work while sick, putting both ourselves and our patients at risk. If RNs work sick, our patients remain sick. Our co-workers get sick. You get sick. This is not just bad health, nurses' health. It's bad for public health. We continue to be short-staffed despite the hiring surge following our historic NISNA contract in 2023. Resources remain limited and nurses keep leaving, creating a revolving door that makes it harder for those who stay at HHC to work. Morale is at an all-time low. And instead of supporting us, H&H is making it harder for nurses to do their jobs. We need a fair and consistent leave policy, and we need it now. Our hospitals are in the fight of their lives with federal medical cuts looming. We should be standing together, fighting to protect our patients and our public hospitals. Instead, we are fighting for the basic right to use our sick time without fear of punishment. We demand a policy that reflects decades of past practice. Continuous sick days must be counted as a single occurrence. Nurses must be able to take the time they need to recover without intimidation, counseling, or disciplinary action. Sick nurses don't heal patients. H&H must do better. Thank you.
Thank you. Thanks for your comment. Joseph Cole, also an RN with NISNA, Joseph Cole. And after that is Hannah Erlenfield.
Hello, everyone. My name is Joseph Cole, and I'm a nurse at Kings County Hospital, assigned ICU nurse MICU. Well, I'm here. My colleagues, and they woke me up from my sleep that I have to be here because I've been actively, advocating about this new change in policy about taking away nurses' sick time. Well, I'm only here for one thing, and I want to say thank you, Mr. President, Dr. Katz, and all the distinguished members. I'm only here for one thing, and that is to say, please do not take our sick time. Please reinstate and restore the policy for sick nurses or the templates or whatever it is. Please reinstore it, okay? Reinstate it. And I have to say, as a nurse at the ICU, I unfortunately, maybe soon or later, I don't know, I'll be going for surgery, back surgery. Why? Because, working overtime, working understaffed, lifting 300 or more, pounds patients, because they see me as a muscle man. So I'm the lifesaver in the unit. Oh, Cole, can you come help me? Oh, Cole, can you come help me? And now I'm injured to the point that now I can only walk with a back brace. I got to put on a back brace. And I remember some time ago, I was so injured that I could not even walk. And my ADN was still calling me to come to work, or when am I coming to work? When I need to be on therapy for at least 3 months for me not to lose my, my ability to walk, and now I struggled to return, I know there's so many instances. Another time, a few weeks ago, my charge nurse, was so sick with the flu, and she had to put on like 3 masks because she was continuously coughing and sneezing and coughing and sneezing. I'm like, why are you here? Why can't you say, Cole, you don't even understand. I just don't even know. And that lady has been, my head nurse, charge nurse has been working there for like 30 something years. I mean, she's not young. I mean, she's, she's at the age, so I mean, she needs to rest, but she cannot because this new enactment of punitive measure that you cannot call out. If you call out consecutive 2 days, that means please. One of my colleagues here, Marcos, I think I heard him use the word power. It's called power. You know how I call it? I call it bully. This is bullying. I know we are just bedside nurses. I remember during COVID, it was said that keep a 6 feet distance, but I'm sorry, Dr. Katz, I cannot even keep 0 centimeter from my patients because I got to bend down, I got to suction, I got to clean them. I got to make sure everything is running. I don't care what infection isolation they're under. And now, I have family, I have children, I have, loved ones, even my colleagues. Now we're all gonna look like zombies. Soon we're gonna die on duty. That's what it looks like. Because nurses gonna be coming to work like zombies because they cannot call out because this is their livelihood. They need that paycheck to survive. And no, they have to come to work because it's a punitive measure that, if you don't come, you're going to get canceled. Please. I'm only here for one thing, sir. Ladies and gentlemen, the high esteem, please. It's a shame, it's embarrassing, and a better description word, I will say it's inhumane. I don't want to say much more. I still have time. Where I come from, West Africa, I understand. But the reason I left and I came here, I thought here there is something called human rights. But now it seems like it doesn't even exist. Does it exist? No, please, I beg you on my knees honorably, with all respect, sir. I don't know how it's gonna work out, but I know you guys are good people. I respect you for all your hard work and dedication to make sure, HHC is stays the best hospital in the world. Yes, of course, that's why I'm still HHC. I started at Woodhall, and now I'm at Kings County, and I'm still gonna be roaming because I love HHC. Please, thank you, sir. I respect you. I see you give me a thumbs up. That makes me believe that you just signed it. Ladies and gentlemen, nurses, say yeah, we won the battle. Thank you, everyone.
Thanks for your comments. Next speaker is Hannah Erlenspiel, and after that is Desiree Peters.
Hi, my name is Hannah Erlenspiel. I'm a nurse in the Kings County ER. I'm a proud union member. I love being an ER nurse. I love being a public servant. I love my patients, and I love my colleagues. I have a few questions for the board of directors, all of which can be answered with a simple yes or no. I know that this isn't supposed to be interactive, but I've seen some of you nodding or shaking your head alongside some other people's comments. So feel free to help us figure out where you're at, because we're all feeling a little confused about why you're implementing this new reinterpretation right now. First of all, board of directors, would you agree that HHC nurses often work outside the limits of the safe staffing ratios that you agreed upon in our mutually bargained contract? Is it the case that in working conditions like these, you believe it's reasonable to expect nurses to only get sick once in a 6-month period? Do you think it's fair for nurses to get called in for counseling if we do get sick more than once in a 6-month period? Do you believe the threat of facing counseling for getting sick more than once in a 6-month period creates an inviting, attractive, or productive work environment? Is it the case that HHC has an issue with retention? Do you believe it is the case that good and qualified nurses would be compelled to work for an employer who is actively recommending a policy under which nurses get called in for counseling if we do get sick more than once in a 6-month period? No. I have another question. Are you allowed to get sick more than once in a 6-month period? And if you do you get called in for counseling? If that's the case, do you think it's reasonable to expect that nurses only get sick once in a 6-month period when, again, we face understaffing and under-resourcing every day? Yeah. My final question is, do you think that this policy is moral, and do you feel good implementing it? And I'll just address my nurses and fellow supporters and community members in here. We didn't start this fight to compromise our sick days, but I know that we're NYSNA strong, we're union strong, and we're gonna end this fight, so.
Thanks for your comment. Next speaker is, I think it's Desiree Peters, also an RN with NYSNA, and after that is Nancy Chen.
Good night to everyone. I am a proud registered nurse at Kings County Hospital on the Med-Surg unit, proud NYSNA member. Now, I chose HHC. I could have gone to Northwell. I could have gone to Mount Sinai, NYU, but I chose HHC. Why? I want to serve my community, right? I'm not here to look pretty. I know I'm pretty already, right? Now, I stand with my colleagues for this new sick policy that you guys reinterpreting. I've heard it's been like that for the past 30 years. 37, thank you. 3 consecutive days is 1 call out. How on earth is this now changing? If I'm sick, dying in my bed, I should wake up at 4 o'clock in the morning to call staff in to say I'm not coming in today? Ridiculous, obnoxious, absurd. We occur our sick time. We deserve our sick time. How would you, Dr. Katz, feel lying in the bed and I'm coming every minute? You're not going to feel safe. You're not going to feel safe, none of you. If your children, your mother, whatever relative is lying on that bed, I'm coming in as a primary nurse with 3 and 4 masks in my face, and I'm coughing excessively, how would you feel? Would you think that your family member is safe in my hands? I don't think so. I don't think so. This policy needs to be looked at again. You guys need to sit and think. Reconsider the fact that nurses, the first line of care, when you come to the ER, the first person you see, the triage nurse. You go to the unit, the first person you see, the bedside nurse. The doctors are not there 24 hours. We are the ones there 24 hours. We are the ones in direct care. I speak to each one of you. Think about this decision. It's going to hurt us. It's going to hurt the patients. It's going to hurt HHC. Without the nurses, HHC is nothing. We generate the money. Without the nurses, the patient cannot get care. Without the nurses' aid, the patients cannot get care. We deserve our sick time. This is something that we acquired. We work to get that. Without the sick time, we are not here. I could have left a long time ago, but I stayed. I'm still recruiting nurses to come to HHC because I love HHC. But if I have to stop, I will. I wrote what I was going to say, but I have to say what is coming from my heart. Please, I beg, I appeal with my other colleagues, please reconsider this move that you guys are making. It's driving nurses away. Personally, it's driving. I have a nurse who's there under 1 year, and she told me about 2 weeks ago, I'm going to quit. Northwell is 10 minutes away from her house. She can walk to her house. She's coming from Long Island, driving to come to Kings County, and she's ready to quit because of that stupid policy. Trust me, it's hurting a lot. We chose Kings County. We chose HHC. HHC didn't choose us. I applied for this job because Kings County was my dream hospital to work. Coming from a little country as Grenada, I love working at Kings County. I have a passion. I take pleasure in caring for my patients. This was my passion since the age of 5. And it's not going to change. Please, I'm begging on my son's life, reconsider this policy. It's not going to help. Thank you.
Thanks for your comment. Next speaker is Nancy Chen, also an RN with NISNA, and after that is Jennifer Minto-Hinton.
Hi, my name is Nancy Chen. I work at Belleview Hospital. My colleagues are sitting over here. Raise your hands. Okay, when they started this policy, I thought it was ridiculous. Why am I getting written up? You know, I'm sick. You want me to come to work sick? I'll come to work sick. Okay, it's not fair. You know, oh, during this period, they pointed out to me, oh, you called in here, you called in here, you here. In what time span? Okay, they wrote me up. All right. So what they wanted us to do is basically get a letter or get a form and file for IFLMA. So that's what everyone's been doing. It makes no sense. Okay. When they're sick, do they get written up? I doubt it. Okay. My manager, she writes me up. I'm sure if she called out sick, she probably would get written up too. Is that fair? How would you like it if your wife was my patient? I go to work sick. I'm coughing, hacking away. Would you want me taking care of your wife or your child? Hell no. So you need to do something. It makes no sense. On my floor, just about every nurse has been written up. Okay? And guess what? They're not sticking around. A few of them are leaving. Okay? And if you want us to retain nurses, you need to change this stupid policy. You hear me? Am I talking loud enough? Okay, is my time up yet? Okay, then I'm gonna keep talking. Did you all hear me? Okay, are you gonna do something about it? I hope so, because it's not gonna end. We're gonna come back for more. We're gonna take it to the public. You don't want bad press, do you? We're gonna go to the news. If it's not changed, it has to be abolished. It's not right. If you want nurses to stay, you need to change this policy. Am I right? Do you agree with me? Okay, then do something about it. It's about time. Okay, I still have time left, right? What else did you want to talk about? Let's see. Oh, and stop cutting the budget. Okay? Do something about that. They're telling us we can't work overtime and they stop hiring agency nurses. They're blaming us because they can't get the work done. Okay? So if you can't get the work done and you don't have enough nurses, you need to start hiring the agency nurses. You can't depend on us anymore because we're sick. Okay? We're not getting paid. We're getting written up to be sick. So you need to start hiring those agency nurses again. At Belleview, no, this is what they said. Oh, we can't hire any agency nurses. We don't have any money, but they have money to write us up. Okay? So what are you going to do about that? Is my time up yet? Well, I hope everyone has a good evening, have a delicious meal, and think about it when you go home to your families. Did you hear me? All right, I think that's enough. Who's next?
Next speaker, Jennifer Minto Hinton, also
Okay, next.
Neisner. Jennifer Minto Hinton. And after Jennifer Minto Hinton is Lisa James.
Good evening, everyone. My name is Jennifer Minto Hinton. I already spoke at Metropolitan Hospital, so I'm yielding to Sonia Lawrence, who is our president.
Thank you. Good evening. Good evening. My name is Sonia Lawrence, and I am a nurse at Lincoln Hospital in the Bronx. I am also the president of New York City Health and Hospital Mayoral Executive Council under the New York State Nursing Association. Nurses also get sick. Sickness does not discriminate. It makes no sense if nurses work sick. Our patient gets sick. Working sick is not only bad for nurses' health, but it's bad for public health. This winter, I have encountered more nurses that are sick coming to work in almost every unit. They are coughing and sneezing at work, caring for patients, sometimes the most vulnerable of our patients. They report to work because they're afraid of being counseled for using their sick time they have earned. Health and Hospital new implementation of our sick leave policy is a problem. It's being applied in an unfair, arbitrary, and punitive way. Nurses are getting counsels for being sick and using their sick time. How and why are we as a healthcare system allowing or actually encouraging nurses to work sick? This is bad for nurses' health and bad for the public's health. NISNA has tried to meet with H&H leaders to address this new interpretation of our sick policy. We sent a letter in early February and heard nothing until late last week. Then H&H canceled the meeting that was scheduled to discuss this problem. Then today we heard that we will get something in writing next week. This is why we're here letting you know we're upset. And our members are feeling disrespected. The way nurses are being disciplined for being sick makes us feel expendable. For those of us who stuck with H&H through the last 5 years of the COVID-19 pandemic, it hurts. Dr. Katz, if you gave your patient a note not to return to work until their fever or symptoms improve, and you learn their employer pressured them to return after 1 day, would you think that this is medically sound? Would you think that the hospital, would you think that a hospital, you can make sure, would you think that that's a healthy workplace? Well, as the doctor in charge of all of health and hospitals, you can make sure nurses feel valued and yes, cared for when we are sick, and we do get sick sometimes. In your words, and I quote, today, ironically, March 18th is the Health Workforce Wellbeing Day, a national recognized day dedicated to raising awareness about the importance of your well-being. The important day highlights the widespread burnout and mental health challenges faced by healthcare workers every day, and promotes our initiative to support your well-being and foster a culture of support and resilience at New York City Health and Hospitals. I know you have been hearing from our members. They have been emailing and calling you, and the CEO of H&H Memorial Facilities demanding and the administration stop intimidating nurses for being sick. Our public hospitals are in the fight for their lives because the federal government is about to slash Medicaid. Labor and management need to be united and fight back together to save these services and save our safety net public hospitals, not fighting one another about nurses using their sick time. We need a fair and consistent policy that follows our past practices going back decades. Contiguous sick days must be counted as a single occurrence. Nurses must stop being intimidated, counseled, or disciplined for being sick and using their earned sick time. Thank you.
Thank you for your comments. The next speaker and the last speaker is Lisa James, also an RN from Kings County. Lisa James. Lisa James? No.
Hi, everyone. Hi. My name is Lisa James. I have been employed at Kings County since 2007, which is about 17 years. I live in the community and pretty much haven't wanted to work anywhere else. The policy that allows three sick calls to count as one, I believe should continue. As nurses, we care for patients who are often ill, and it's common for us to become infected ourselves, which can then in turn affect our families. We need the time to recover without the fear of being, we need the time to recover without the fear of job-related consequences. I'd like to share a quick story. A couple of weeks ago, I had a patient encounter, and unfortunately, I had to take some prophylactic medication. Nevertheless, I was required to come to work, although I was feeling ill every single day for the last 16 days. And I don't think it was fair. Was I able to provide the care for my patient that I usually do? No, I was not. Did management really care? No, they did not. And I feel that after working there for about 17 years, that I shouldn't really have to encounter something like this. You know, I feel like I gave my time, I gave my years, I gave my youth to to KCHC, 17 years. And pretty much please just reconsider this policy. You know, please just reconsider, because I really don't think it's fair. I really don't. That's it. Thank you.
Thank you. We've reached the end of our speakers. Thanks so much for participating, and get home safely. Thanks.